In this video, we're going to touch on hemorrhagic strokes. So as you know, strokes come in two forms, hemorrhagic and ischemic. When we're talking about hemorrhagic, we're talking about a hemorrhaging in the head, which is causing bleeding. So as opposed to ischemic, which is there's some sort of a blood clot that is depriving blood to get where it needs to go. With hemorrhagic, what's happening is there's active bleeding. So there's two problems there. It's ischemic in the sense that the blood's not going where it needs to go, and it's also putting a lot of pressure because the blood is swelling inside the head and it's putting pressure on multiple areas of the brain, causing ischemia there as well. So hemorrhagic strokes have a very poor prognosis, and this is in part to, as I told you, it's a two-parter. It's not getting where it needs to go, and then also it's putting ischemia on multiple spots of the brain, and then also because bleeding can just happen so quickly. So what are some risk factors for hemorrhagic stroke? Hypertension is a big one. As you have high blood pressure, the chances that you'll rupture an aneurysm or a blood vessel increase because of increased pressures. A family history, and this has to do with maybe family history of weak vessels in the brain or development of aneurysms. And the use of anticoagulants, because with anticoagulants make it to where two things happen. One, once you start bleeding, it's harder to stop it. And two, you have an increased risk for the bleeding to start in the first place. So patients that are on Plavix, Coumadin, aspirin for cardiac reasons, they are at increased risk for developing a hemorrhagic stroke. So what are the signs and symptoms of a hemorrhagic stroke? The big symptom here that you'll see is a blinding headache, and then shortly after you may see a loss of consciousness. And this is because the huge headache, there's all that pressure on the head, and you're probably going to develop, if it's a big enough bleed, might be sudden enough that you may just pass out. So time is very important for hemorrhagic stroke. As you can see, the only treatment here really is to go in and stop the bleed. And so time is very important here because you'll be constantly bleeding and your brain putting more and more pressure on it. So, diagnosis. Well, they came in, blinding headache, perhaps unconsciousness, or some of these other signs and symptoms. Typical stroke symptoms, weakness on one side versus another, changes with mentation, changes in consciousness, changes in ability to swallow, to speak, to read, to see. These are all signs of stroke. So they'll see that, and what they'll do is they can do an MRI or a CT scan, and then maybe they'll see the bleeding and the pool of blood in the brain. Other diagnostics, they could do a lumbar puncture in some cases, and if they find blood in the cerebral spinal fluid, that's a sign that there's bleeding. Also, they just monitor the Glasgow Coma scale, and so they'll see, hey, there was a change here, a loss of consciousness. But the big telltale is they'll do the MRI or CT, and they'll see the bleed itself. Hopefully someone reacted quick enough and they're able to do surgery to evacuate the clot and to get in and to stop the bleeding and get rid of, when I say the clot, get rid of that pool of blood putting pressure on the brain, and then also close off any further bleeding going onto the brain. Also, they're going to stop any anticoagulants, and if they find the patient has a bleeding disorder, they may give medicines to decrease their risk for bleeding, such as if their PT is elevated, they can give vitamin K, or if their PTT is elevated, they can give other clotting factors. And so with hemorrhagic stroke, really blinding headache, other stroke symptoms, possibly passing out, and it's an emergency surgery.